Hi, I'm Ariel Davidson, and this is for Nursing 491 Servant Leader interview. I have with me Jenny. And Jenny, it's my understanding that you give me permission to use this for my school project?
Yes.
Perfect. Tell me a little bit about yourself.
So I'm Jenny, and I've been an ICU nurse for 4 years. Worked in many places, Virginia, Florida, now California, as a bedside nurse the whole time. That's pretty much my nursing background. I've served on different committees and been pretty involved in all the places that I've worked as far as making change at the bedside. So
perfect. So what are some of your personal leadership strengths or weaknesses that you have?
Well, I would say that I'm personable. I get along with people. People like me, and not everyone, but for the most part, people like me, and I like being around people.
You are very good with people. I will agree with that fact.
And I'm confident in what I know and don't know, so I, can come into a room and kind of take control of the situation and make people feel comfortable that I know what I'm doing. And if I don't know what I'm doing, I know how to find help for that too. So I'm responsible. I take responsibility for my actions and what I'm doing. Know when I'm wrong and need to admit that, but again, can take control of the situation. I have integrity, so I do what I say I'm going to do when I say I'm going to do it, and I think that's really important for patients and as a nurse. I'd say those are the big ones that you can think of offhand.
I think integrity is a great quality for leadership to have, especially with patients, their ability to be able to trust you. I think you have that great, that servant's heart where you come across very personable with these patients, so they're able to trust you right off the bat.
Yeah, you have to build that relationship, rapport, and you want people to trust you as their nurse for sure.
Exactly. So we're talking about servant leader in the leadership role. So what would be your definition of the servant leader?
Well, I would say using the first word of servant, that you have others' best interests in mind first and foremost, that you want to serve others and think about them and their needs, and then secondly, that you could lead others to accomplish common goals related to serving the best interests of whoever it is that you're serving. So that's kind of a short definition, but yeah, focusing on serving others and their needs, and then encouraging, motivating, inspiring others to join you in serving that common need or goal.
Where would you get your servant leader qualities from? Who do you look up to obtain those qualities?
Well, as a Christian, for me, I study the Bible a lot and know a lot about Jesus and his kind of qualities as servant first, but also leader, that he came to serve others and their needs, and kind of fulfill our deepest need as humans, but also to inspire and compel us to serve his kingdom with him. So definitely Jesus, but other than that, also just good leaders that display some of the qualities that we've already discussed. Look up to them because they do it well, and try to reproduce that. I think the best leaders are those that still have the best interests of those they're serving in mind, and can kind of motivate those people to work toward a goal together. If you don't feel like your leader is in touch with what you need or what's important to you, you're not going to be very motivated to serve with them or for them. So yeah, I always just look to those that I've worked under some really great managers and bosses, and a lot of them are Christians because they kind of touch the same traits of Jesus that I was kind of describing. And I don't know if
that's great.
Answers, but
yeah, it does answer it. So from all that we've spoke about just now, do you describe yourself as a servant leader?
Yes, I would say I've always displayed leadership qualities throughout my life in any area that I've been. I kind of, if there's a situation where no one's stepping up to take care of something or doing something, I kind of come together to say, okay, we need to do this. And I've always been a leader from a young age, but then as I matured in my Christianity and just life, and discovered that I have an interest to serve others and those sort of things. And the job, the career that I chose as a nurse, it's all about service and serving others. And so yeah, I would say that I'm a servant leader, and that I try to keep others and their best interest in mind every day when I'm at the bedside with patients. And yeah, I think we were going to maybe a specific example of that.
Yeah, do you have an example?
Just like I was about to go into as a nurse, I always worked in the ICU, so patients can't speak for themselves. A lot of times they're on ventilators, and or even if they're not in the ICU, just patients are in a very weak and vulnerable state. They need other people to stand up for them and to take charge, because they're not in a position to really be able to do that. And so I get really passionate about my job as their advocate to find out what they need, what they desire for their goals of care, and what they want the outcome to be, or if they can't speak for themselves, what their family would say the person would want, and use that to kind of motivate me to take charge of the situation and make sure those things happen for them while I'm in charge of their care. Because we have to work with doctors and other nurses and physical therapists, the whole interdisciplinary team, if you will,
Right.
to ensure that everyone's on board with this is what the patient's goals are and how can we all work together to make that happen. So yeah, and I really like to, when I give report to the off-going nurse, make sure that they're in touch with the patient and know them. And we do a lot of cool things in the unit that I currently work for to make sure we know patients. And we have this All About Me poster. The patients, like I said, can't speak for themselves a lot, but we have a poster that tells us not just about, we already know their medical history and all of that from the computer in our handoff report, but there's a poster in everyone's room that says like what they prefer to be called by, what are some of their favorite things. So we try to really get to know patients beyond their sickness and illness, and I don't know, pair that with, oh, so your long-term goal is to actually go home and be functional. Is that possible? And if it is, what can we all do to make that happen? And yeah, that's probably the biggest example. I do that every day. So
I have one more question for you. It has to do with communication. I know this isn't really on my paper about servant leadership or anything. I'm just going to throw this in here. I've been learning a lot about communication and how proper communication works for the interdisciplinary team. If the proper communication isn't there, the team kind of falls apart, or the patient's voice isn't heard. Have you ever experienced a situation where that has occurred?
yeah, I would say most often, especially in the ICU, when someone's so sick, they've got drips and tons of stuff going on, we can easily lose sight of what the patient might want, or what the long-term goal is, and just start treating every problem that they have and doing more and more things. And maybe the patient doesn't even want to continue on because their goal would be to be functional, and that's not possible with what they have. So I think the biggest example is the doctors having to kind of go to them often and say, we need to have a family meeting, we need to readdress the goals of care, we need to talk to the patient and the family and find out, like, are we doing what they would want? And because we all get busy and we forget to remember, oh, they're a person and they have things that they would want. So yeah, I think the biggest area is me communicating with physicians to have family meetings, because you may not believe this, but there will be weeks that can go by where the family never actually directly talks to a physician in the hospital. So I do that a lot, like arranging family meetings where everyone's present, the physician, the nurse, the family, not the patient a lot of times. It's nice because they can't physically be there, or if we do it in the room, I guess they're there. But when we bring occupational, we bring as many people as we possibly can that are taking care of that patient to this meeting. And I try to make that happen regularly, or see when that last happened and then make that happen if it hasn't happened recently. So.
Yeah. So in your past work environment, or maybe a past boss or manager, have you had someone that has showed you these servant leader qualities that you now use in your own practice?
Yes. I would say the best example of that was my boss in Florida. That was my second job as a nurse, and she was just really great at motivating everyone to work together. And she did that by, she showed a lot of grace and compassion to us when things were wrong and needed to be changed. It wasn't an environment of rebuking you or just coming down on you really harshly. I've been in those environments, and those are not good workplaces. Everyone is fighting and it's just bad, but she created kind of a culture where we knew we could make mistakes and it would be okay, we could be corrected on it and move forward, and that we could work together to still accomplish goals. It was just a very motivating place to work, an encouraging place to work. So taking those qualities to the bedside of showing grace and compassion on others when things aren't being done correctly, by being able to turn it back to what is the goal and then motivating others to work together to accomplish that. And a specific example is I serve on some of the committees in the hospital I currently work in, where we try to reduce infection rates like central line associated bloodstream infections or CAUTI, the catheter associated urinary tract infections. And we're very, very busy in the ICU. All places are busy, but we have a lot of tasks to accomplish, and sometimes we are too busy stabilizing a patient to worry about cleaning their Foley, for example, but we need to be doing that every shift. And so one of the things my committee has come up with, rather than just rebuking everyone on how horrible they're doing with getting their Foley care done and getting it done early, we're like, well, how can we all work together to still make sure this happens so that our infection rates are reduced? And we have a nurse, it's our resource nurse. They are there to do breaks and kind of just be extra hands, and we're like, why don't we use that person to go around all of our beds and ask the nurse, have you done your Foley care? And if the answer is no, it's not, oh, you're in trouble, you're being audited. It's, all right, I'm coming in and doing it for you. And it's really a good way to make sure we're still reducing infection rates, because that's what's best for the patient, but working together. And I think that's...
And I'm sure it relieves the nurse on duty as well. They know, oh, if I don't give my Foley care, I'm going to get yelled at, but instead of, thank you so much for helping me with this.
It's really, really awesome. Or, again, those resource nurses also break us when we go for our lunch breaks, and they always are like, what can I do to, help you? And it's oral care, Foley care, give this person a bath, like things that are very, very important for bedside care, but in the ICU where somebody's unstable, that's kind of at the bottom of your priority list, but it's still super important. So we make sure all those things still get done by using people like that, and then no one feels, like you said, rebuked, overwhelmed, rebuked, all of those things that don't motivate people to do better. It makes people just want to go home and cry. So try to avoid that and create a culture where we work together. And so I serve on committees that think of ways to do things like that.
That's great that you're getting involved. I want to thank you again for helping me with my project.
For sure.
And I just want to end by saying, as nurses, we all work together for a common goal. We are the advocates for the patients. And as a leadership, we have to stand up for the right of those patients, no matter it be to the doctor or the family member or maybe another patient on the floor.
Yeah, absolutely. Thanks.
Yeah, I didn't hear him stop it. You can stop it. Stop.